Hey, it's Justin Harvey. Thanks for tuning into the Anesthesia and Pain Management Success podcast. With APM Success, we take a close look at important topics pertaining to business, practice management, personal finance, and careers for anesthesiologists and pain management physicians. We work hard to take your critical questions straight to the experts. Thanks for listening. Hello and welcome to another episode of APM Success. I'm very excited today to be joined by Dr. Nasir Khatri, who is a double board certified anesthesiologist, pain management physician. He is an accomplished clinician and business person. He wears many hats, as physicians of his profile often do. He's currently practicing in Michigan. He is involved in the American Society of Pain and Neuroscience, leading their Early Innovators Initiative. He is the president and chief medical officer of Criterion MD, which I'm excited to talk to him about today. Dr. Khatri, welcome to the show.
Thank you. I appreciate you having me, Justin. I think it's going to be a great conversation. Thank you.
So, yeah, I enjoyed meeting with you in person a few weeks ago in Miami at the Aspen meeting and hearing a bit about your journey professionally. So there's the sort of the clinical journey that everyone who listens to the show is probably familiar with. And then there's the business and dynamic problem solving and sort of developing other technical expertise journey that ran in parallel with developing those clinical skills. So why don't you describe for our listeners, what are you doing right now clinically? And then how did that clinical journey spawn creativity to try to solve some of the challenges you bumped into along the way?
Yeah, so it's funny because you describe them as two separate tracks, but really in my mind, they're the same thing moving in parallel with one another. One of the things that I really enjoy about being a physician is the fact that, especially as an anesthesiologist, I'm sure the listeners can appreciate this, and as a pain physician, is that we have to iterate on the go just to be able to kind of solve for the problem at hand, especially with anesthesia, where like you have seconds to make a decision and you have to make the right one. And if you don't have the tools or the supplies that you need in that moment, well, these are the things that you have, and how are you going to make do with it, right? And that was one thing that I really took away from my anesthesia training. I don't really do anesthesia much anymore. For the past 5 years now, 4 years, 5 years, have really just been an interventional pain physician. But that sort of philosophy has always stuck with me. The I serve at Insight Health Systems in Michigan as the director of neuromodulation. And I came on here 3 years ago specifically to take on that role and to solve the problems that they had with regards to how do we provide access to patients for this therapy in a way that, minimizes the delay in care, is financially solvent for our institution, and of course, ensuring that patient outcomes are paramount and top of mind. And so I'm grateful and feel very blessed for having been able to contribute to that. And, we've done some good things. But that's another example of just, you see a problem, how are you going to fix it with the resources that you have that are realistic, and then make it happen. And so Criterion MD, so I'm the chief medical advisor for this organization. And I know myself, you have to be very honest with yourself. I know myself, and I know that I'm not the entrepreneur type who's going to go and take risks. Kudos to the people who can, because they're the ones who end up, doing amazing. But I can provide solutions to problems. And if someone's willing to hear me out on it and they are inclined to want to develop that solution, then I'm all in and I'm happy to help. Right. So that's sort of the role that I have at Criterion MD. And without it taking up too much time, what I'm going to say is the first product that we're launching is Insurify. And the very specific problem that it's solving is, I think, as providers in general, APPs, physicians, et cetera, the thing that we kind of are really just sick and tired of is all this after hours administrative work, whether it's to satisfy the whims and desires of our administrators, who I very much respect and have a great relationship with where I work, or for insurance companies, which, as much as we kind of, get annoyed by them, they are a necessary part of the system as well. But how do we empower ourselves? How do we advocate for ourselves to be able to kind of, have a eye-to-eye conversation with the insurance companies? That's where Insurify came from, solving that problem of all the additional documentation burden, delay in patient care, delay in revenue, that so many of us providers around the country across specialties deal with. So Insurify is the first product and only product on the market that provides real-time feedback to providers before the clinic note is signed to ensure that all the medical necessity criteria for whatever was recommended is in the note and is compliant with the insurance language to ensure that there's no delay in care.
One of the reasons I'm very excited for this conversation is because working with the cohort that we do at APM Wealth, lots of pain physicians, in particular the private practitioners who are dependent on the revenue cycle
Yes,
operating as it should to be able to pay their bills as business owners.
absolutely.
Everything that you just described, like I've had the conversations with clients of mine. They're like, I'm in the clinic all day, and then it's 3 hours after the kids go down to get all the notes buttoned up, or
Yep.
the AR is getting dragged out longer and longer and longer and longer, and there's so little recourse. Having a tool to be able to empower and equip, especially these doctors who are stuck in this morass of, I'm just going to call it administrative hell. Maybe you
Yeah,
can have a
yeah.
more diplomatic version of that as the CMO. I am excited to equip and empower docs with these kinds of tools. So, for you, as you sort of on the whiteboard of your brain started to map out what Insurify was going to be, did you have a specific moment or a specific conversation or even a season of maybe it was a clinical rotation where you started to think about what are the component parts of how this would need to work that you can look back to?
So I attribute a lot of the what my knowledge when it comes to insurance in general to the physicians who I trained with at University of Kansas when I was a fellow. And I learned at least like the basics there and just recognizing the reality of practicing medicine, which is that insurance is a part of it. There's, the textbook part of it. There's like the rotation where you don't have to think about that stuff at all. And then there's the reality when you get closer and closer to the end of fellowship, especially, and then you're about to be in real life practice. And then these things are going to be, day one, this is part of, what you have to be dealing with. So I learned a lot there. As time went on, I'm just someone who's always like looking for a problem in a positive way, I would say at least, just so that I can try to find a solution to it, right? And when I started seeing how many patients who I really felt would benefit from an injection or some sort of a treatment, or maybe even just I really need to get an MRI for this patient, and I've had situations where like, guys, the patient's myelopathic, and I need the cervical MRI ASAP, or at least I'm concerned that they're myelopathic, right? When I start seeing delays in that, and it's because of one sentence was missing in a note, which wasn't even as important as the part where I said concern for myelopathy in my physical exam, et cetera. That to me was the moment when I was like, we got to do something about this. And 3 years ago, I tried building this thing out just on ChatGPT, back when, it was still early on, and it didn't really work all that great. Slash, I don't think I really knew what I was doing. And I was like, forget it. Someone else is going to come up with this, and then I'll just use it. Who cares? 3 years later, no one came up with it. And I was like, this is still a real problem for us, guys. And so that was the first thing that I pitched to the executive team at Criterion was we should have this product, a tool to be able to help, as you mentioned, the doctors and providers who are worried about their AR or having to, document stuff after they put their kids down for bed. Those aren't things that should be expected as a norm for us, though I think that unfortunately maybe we have accepted it. As there's one message I want to get across on this interview, which is that I would hope that all providers, healthcare providers in this country, feel that there is a chance and an avenue for us to be on a level playing field with hospital administrators and with insurance companies, so that we don't feel like we're just being punched down on. And I'm not saying that they're intending to do that, but unfortunately, for many providers, that's how it feels. And so, if we can arm ourselves with tools that are just, for lack of a better term, common sense tools to, that we can provide as a company to those providers, we'll do it.
So tell me about the process of building the 2.0, where you vibe coded in ChatGPT 3 years ago, and then you're like, let's come back to this and let's give it another try. We're probably going to need some technical experts, and probably you've developed some technical expertise along the way. What did the renaissance of this initiative look like?
So that started all with the executive team at Criterion reaching out to me and asking me to, serve in this role as their main advisor from the medical standpoint. And I'll be honest, I kind of blew it off at first, because I was like, just another company that is, riding this wave right now, and they're just going to have a bunch of Me Too products, and I don't want anything to do with that. I'm busy enough. Thanks, guys. But then they kept persisting, and I gave them an idea, and I pitched them this exact thing, this Insurify, and same exact conversation, and they ran with it, and they created a prototype. They asked me to vet it out, and I was like, "Whoa, you guys are serious right now." And so when I had further discussions with them, it became very clear they are looking to solve actual problems that providers face, and they at least have the humility enough to be able to say, you know what, we might be able to figure out how to make that solution happen, but we don't know what the problem is, and we don't know what the exact solution is. But whoever tells us what the solution is, we can build that. And so when I mentioned the insurance headaches and I mentioned Insurify, um, they were bought into it, and now we have several other products in the pipeline that we're going to be coming out with here in the next several months that are not Me Too products. They are one of one products, or 0 to 1 products, if you ever have read the book by Peter Thiel. But they're solving a problem that every other company has solved about 70% of the way. But clinicians who deal with this every single day know that the remaining 30% really doesn't take all that much more, but you just got to know what that 30% is. And I feel very grateful that as a practicing physician still, that that I know what those are, and I really hope to be able to benefit the entire community of physicians, AVPs, et cetera, to be able to benefit them and patients.
I enjoyed reading the short blurb bio of your C-suite counterpart, Mr. Mustafa,
Yeah,
who
yeah.
who says he builds software with physicians, not at them. I
Yeah,
thought, what a great ethos for a company trying to solve these problems and being
yeah,
embedded with the doctors who
yeah.
more closely observe the challenges that you're trying to solve. So, as tell me about the process, because I'm sure there are other smart people out there listening to this podcast, and some of them may be motivated to have their idea take flight, and others are probably just intellectually curious. And what does it actually take to get something where now you're about to launch in many, many practices as a sort of a trial beta period to get feedback and
Sure.
everything? How do you go from the marker board of your mind to we're about to go live?
Yeah, so there's a lot of steps involved in this, right? Just because I think it's a good idea or that I think it's a pain point in our practice, it could just be a Nasser problem. It's like, bro, get it together, man. No one else has this problem. So the first part always, when you're going through this, actually, regardless of what the whatever you're trying to create, is there a product to market fit? You know, is there a problem that you can actually articulate well enough and describe well enough to be able to then find a solution to it? And I think that usually that really comes when you have an expertise within that domain itself. That's the first. The second thing is, once you feel within your close circle, and you have to always be mindful of, like, are you just kind of hearing from yes men that are just trying to make you feel good, or are you getting honest answers? Is then kind of go out, and that's what we did at Aspen. Was we did a lot of this work way before Aspen, but at Aspen I was very intentional. I was like, because of my involvement in Aspen, I can recognize that people are aware of my name at least. And so I did not want my name to be like obvious on any flyer, right? Because I wanted to see what's the organic traction here. And as we had those conversations, it became very clear that regardless of where in the country you were, even if you were in Hawaii or Alaska or any other state, that problem was the same regardless. And when you then kind of explain even further that, guys, this is as I mentioned in Miami to you, that the version of this that we're releasing right now is intended to stay free forever, because this is a way for us to be able to band together as physicians and providers in general, APPs included, to sort of, I don't want to say fight back with the insurance companies, but at least raise ourselves up to be on a level playing field with the insurance companies. Because for far too long, we've just been beholden to them. And I think that we have an opportunity now to leverage the tools that are available in this world to really, stand up for ourselves.
So, why don't you describe for me maybe a 15-minute clinical experience on a busy day in your clinic and the current experience of a frustrated physician and how Insurify plugs into that to proactively solve the challenges that they're facing?
Yeah. So, I mean, this is I'll tell you what my workflow is. I think that every provider is going to, and every practice has a little bit of a different workflow, but the end result is almost always the same. So I'll see a patient in clinic, they're having back and leg pain. I've already seen their MRI. And, sometimes we have busy days in clinic. And so I try to be mindful of what's their insurance and if I can recall the obvious things that I need for their insurance. But sometimes I miss it. Sometimes it's a random insurance policy that I haven't really seen before. And so what happens is, I'll say, hey, I think we need to do a L4-5 epidural, right? I'll document in the note and I try to be very diligent with my notes. And yet still, I'll get an email from our authorization team after I put the order in, maybe a day or two later, saying, hey, Dr. Khatri, can't submit this because you got to change these three things in your note, or you got to add these three things in your note, whatever that may be. Now I'm yet again in a busy clinic day where I'm already documenting for the patients who I'm seeing. I have to at some point get downtime enough to be able to go back to that chart, change those, unlock the note, make the changes, put it back in. And now, for someone listening, they might say, well, one patient every once in a while is not a big deal. Well, when it's, and I've seen this with many physicians, when it's 4, 5, 6 patients a week that you have to do that for, it adds up, you know? And then that's care that's delayed because now we're waiting to submit the authorization. And so the end result, as I mentioned, that's always the same is you got to either change the note or hey, Dr. Khatri, you didn't document this thing. Oh, well, I guess I never asked them. Now we have to bring them back to clinic or I have to call them on the phone and who knows if they're going to pick up or not. And then now we're even more delayed, right?
So, as a non-clinical person, I'm going to ask some stupid questions.
Not stupid at all.
As
Sure.
you close a note, you send it to, is it your in this case, it's like an internal billing team under your roof that is reviewing before claims are submitted to insurance. Is that the workflow here? How does the claims team identify a gap in the note? And how does the Insurify sort of take that? It's happening on the second step to now it's integrated into the first step of before the note is locked the first time.
Exactly. So so we have a pretty good off team here at Insight. And so before they won't even submit if they're like, oh, the diagnosis code in here is wrong, or it's missing this physical exam finding, or we never talked about the percentage of relief with the last injection. And they know because they see all the denials as well that okay, this insurance company is very particular about this very specific thing. Dr. Khatri, or any of my partners, we're not going to even submit this until this thing is changed because we know that this is just going to turn into a denial, which is then going to delay things even further. And so, but at other practices, they may not have that workflow. They may actually just go ahead and submit everything to the insurance company. Now you're waiting for the denial to inevitably come in, or you're outsourcing that job to a not in-house, but a third-party company that may do the same thing that our current auth company, our auth team is doing. How Insurify comes in is that before I lock that note, all I hit is analyze, and it reviews the note, figures out what I ordered, matches it to the patient's specific medical policy, and then tells me right then and there what am I missing in the note. So if there was a brain fart moment for me, for example, and I didn't document 2 or 3 things, or even when it was one thing in the note, I'll know right then and there. The note will be complete and ready to go from a medical necessity standpoint to the insurance company. And then now that auth team, which is for me in-house, for others might be outsourced, or some might just go ahead and send everything to the insurance company to get approved. That now we don't have to wait for either the denial or that inevitable email, text, phone call, note on your desk saying, hey, you got to change this on your note.
So Insurify is comparing the content of the note to some known database
Mm-hmm.
of insurance company requirements, which I mean, I'm picturing in my head like all the different, the 50 different line items of everybody you're contracted with, and a lot of names look exactly the same. And I would surmise each of those may have, or maybe it varies by family of insurance company. They have their own requirements for if you're going to do this procedure and you didn't do this one thing or document this, pain relief or this necessary predecessor procedure
Right.
that is a gap in the note. But aggregating the information, essentially like the personality of each of these different insurance companies, sounds to me like perhaps that's the proprietary portion of what you're doing. Or I guess what I'm asking is how do you build the database of I mean, it sounds like you have good volume in your clinic and your team sees what gets denied. Is there an aggregation of multiple perspectives on, for example, every insurance company in the state of Michigan, all the pain docs are throwing all their denials in a bucket and we're using that, or what's
Well,
the
yeah.
basis for comparison?
So this is a little bit of the secret sauce, but the secret sauce is the fact that actually it's not very secret at all. If anyone ever reviews, and I actually, this is a genuine recommendation to all my colleagues out there, physicians, APPs alike. If you get an insurance denial, just one, pick it up, read it. There's going to be like probably 6 or 7 pages that they scanned or faxed over. They're all irrelevant except probably the one sheet in the middle of the stack, which is the only thing, and it's going to be 2 paragraphs. And it's going to tell you exactly why they denied it and the specific medical policy that they are referencing. If you copy paste that into Google, the first result that's going to come up is a PDF on their website of that medical policy. It's all available online. It's not what we're doing is not some like, oh my gosh, like how did they figure this out? Nope. It's always been, the answer has always been right under our noses with the medical policy written right there, available online for free, not behind a paywall, not for most of them, not behind like a login screen or anything. Yes, now there are some that do require you to have portal access. You have to be, like on their insurance panel, and then you can. But then your off team would have that, and so, or you would be able to request access to yourself as a provider who's credentialed with that specific insurance company to again get those medical necessity criteria policies and be aware of that. All we're doing is across the country aggregating all of that into one single database so that regardless of the insurance company that you have, that medical policy is in the database. And now we can, whether you're in Hawaii or Michigan or in, Alaska or Florida, doesn't matter. You can provide the same service to patients and ensure that there's not going to be a delay in care or an inappropriate denial.
I remember going to some of the ASRA practice management sessions like
Yes.
5 or 6 years ago, and the conversations they were having about how the billing teams would have to essentially manually assemble the
Yeah.
lists on a per CPT code basis, on a per
Yeah.
insurer basis, and then periodically refresh because
Hmm.
they're subject to change over time. It was a very manual process. And
Yeah.
essentially, what you're describing is the automation of the aggregation of this data in order
And
to, in
whenever it
real
hits.
time, preempt these challenges.
Exactly. So medical policies, if you read them at the top, they'll say, when was it published? When was it last revised? And I'll say the name of the policy specific, like PM001 or something like that. And so this is, again, they're not going to tell you, they'll tell you like anticipated next revision date. And then they may just end up revising it 3 months earlier and they're not going to let you know that they did. Right. And so in those cases, that's where, the added value of Insurify really comes in because we automate that process. As soon as it's updated, it's in our database. We have the updated policies. And so when you hit analyze and it's day one of this new policy, if something is missing in it that was never an issue before, now all of a sudden it is, it's because, and I'll tell you, there was a change in the policy 1 day ago, 2 days ago, and those things matter, you know?
Tell me about software integration.
Yeah. So speaking of things that I
The
have to,
devil's in the details, I'm sure.
oh my gosh, yeah. So, this stuff was foreign to me up until a few months ago when I started getting involved in this because, I never really had to think about it. I thought of a solution and I didn't think about any of the really relevant details. And so, software integration is a huge one. Well, you were mentioning earlier, what are all the steps? Well, besides product market fit, et cetera, there's also all the compliance and the legal kind of hurdles you have to jump through and have to be compliant with to ensure that we as a company are protected, that the providers who are trusting us are protected, the practices, the hospital system, et cetera, and of course the patients as well. So HIPAA compliance, as well as there's many other types of frameworks that exist out there as well. I'm sure you're aware of, like SOC 2 compliance, are things that are top of mind for us. And so when it comes to the software aspect of this, you know, there's difficulties with integrating into EMRs. And there's the way that's like the A+ way of doing it, and that's going to take years to do potentially, right? And we don't want to delay getting this um, program and this software available to providers um, uh, so that it's like an A+, you know? So there's going to be, if we cannot currently integrate in any way with the EMR, the first thing that comes out is you log on through the Criterion MD website to your Insurify portal, and there you will, uh, copy paste your note basically into Insurify. The medical policy will be detected, the procedure being recommended will be detected, and then it'll spit out what all the issues are, if there are any. And then let's say, there were 4 things, right? That need to be changed to the note, and there's a total of 11 criteria, let's say, right? But there's one of them is like required because based on, and this part is part of the secret sauce, is like giving weights to each of the individual criteria, right? Because based on the denial data that we have, we know which insurance companies put a higher weight on this element. So they're very stringent about the specific wording that needs to be there for this, versus for another element, they're okay with a little bit more loose terminology to satisfy that requirement. So let's say you're missing one required thing, 3 recommended elements. You change those in the note, you hit analyze again, and then you get a 11 out of 11, so 100 score, right? In that case, then it pops up that it'll be Insurify certified. The reason for this is actually one, to say, all right, your note's good, you're good to go ahead and lock this now, submit it for authorization. But the other thing is, we are very aware that sometimes we've all had those peer-to-peer conversations where we say hello on the phone and the guy just says, yeah, you're approved. And so there's something on their back end and their workflow where someone missed something, or perhaps a AI software missed something. I'm not saying that that's what they're doing, but it's plausible that a insurance company out there uses AI software to read these notes and they miss something, right? And so we will. Medicare published something in March, which is like 6 to 7% of all denials are inappropriate denials, meaning that there was nothing missing in the note in the first place. We kind of want that because we're gonna. We can't do anything about it except that for the ones that are Insurify certified, there's a button that you click there. You upload the denial letter. It gives you an instant appeal letter. At the top of it, it says Insurify certified. That's our way of kind of getting into the faces of the insurance companies and saying, hey guys, we're here. And we're going to back these doctors and these APPs and these patients. And we're not playing this game anymore, or if we are, then now we're actually in the game. We're not sitting on the bench anymore. We're not just kind of waffling around on the field. We're here to play. Yeah.
So there's the sort of third party kind of, you're describing like a little bit more of a manual process
Oh yeah. So
preliminarily.
that's
Tell me
iteration.
about the various phases of software integration.
Absolutely. So the second one is a lot of people, especially in outpatient practices, use a browser-based EMR, and even Epic can have a browser version, which I just used today. And so there will be a browser extension that we use. Now, all the HIPAA and all the other necessary security elements are going to be in there as well, of course. And we only retain the data that is absolutely necessary, and then at that point, we get rid of it, primarily actually to be able to write the appeal letter, and so for the ones that are so the second one will be a browser extension, which will be for Insurify. And then the third and final one, which is what we're working towards actively, is actual integration into the EMR itself, right? There's a value to be shown to EMRs, which make money based off of billing. And, the more that you can provide a service and, charge for it, and this benefits them. Hospitals and practices that, of course, we're improving access to care as well as timeliness of care. Um, and so that's the final and kind of, you know, uh, that's the intention there.
So tell me about where you're at in the rollout process and what the next 6 to 12 months will look like.
Yeah, so it's game time for us now. So next week we're going actually this week, we're going to be sending out our first pilot cohort of 100 people who sign up for the wait list at Aspen to join the pilot program. And we definitely need that data and that guidance from real physicians and APPs around the country who are seeing patients in different states, and try to iterate and improve this. And I don't care actually if the executive team gets very upset at me being very honest right now, because I'm a big proponent of being honest. you know we're going to grow this thing together. you know and as a free product, this version is going to remain free. I have I would hope that we're all going to kind of feel like this is our way of being able to get back to the insurance companies, do good for our practices, do good for our patients. And so we will be launching in exactly 13 days. Insurify is going to go live to those first 100 people on the wait list. We're going to have an onboarding call, and that email is going out either later today or tomorrow for those first 100 people on the list. And then shortly thereafter, we'll bring on the rest of the people that are on the wait list. And then just to, I know that the audience here is probably mostly anesthesia pain medicine, but we intend very shortly thereafter, within the next 2 to 3 months, to roll out into other specialties and go beyond. Right now, it's just on injections, but medications, imaging. Basically, if there's a medical policy for it that gatekeeps access for patients, Insurify will be there for that.
Tell me about the economic model.
So, as I mentioned, this is free. Now, what's interesting is, I've got this question so many times, but there's tons of free things that we use every day. I mean, we get on Twitter, and we get on X now, or Facebook and Instagram, and these things are free. And I was
There's a cost to all of them, though. And you and I had a spirited conversation about this.
Yes. And so it's funny because, I said that at Aspen, and it like raised eyebrows, and then I thought to myself, I was like, maybe not the best example to use, because they're basically out here selling privacy, which is not what we're intending on doing. I think the conversation is about Insurify. And so it would make sense to be like a real head scratcher. Why you made a company, you have a product, you're giving it away for free. You're not going to sell privacy. What is going on here? This is just one of many products that we have in the pipeline that are going to be coming out over the course of the next 6 to 12 months. And for us, we recognize that we are the smallest little guppy fish in a gigantic ocean filled with sharks, right? We got to be able to survive. And one of the best ways that we can is being able to provide a service that is genuinely valuable to providers. And even if it means it's going to be free, there's ways that we can do this with cost controlling, or the way that we're doing it, so that we get as many people as possible using this and finding benefit with it. At that point, then we're integrated into workflows. And if those providers then find value in the other products that we come out with that do solve those problems 100% of the way, not 70% of the way, and there may be a charge associated with many of those, and they're not going to be unreasonable charges or anything, then we would hope that we would be able to kind of serve those providers as well. So that's the economic model here, is that get embedded into workflows, provide a valuable service. And then, I get it. We're in a bubble right now. There's an AI bubble. There's, the stock market's kind of riding a wave right now, all these things. Eventually it's going to crash. But in the late 2000s, there was a crash. There was a dot-com bubble, right? And then in 08, 09, there was a real estate bubble as well. But that didn't mean that you could just go buy some gigantic mansion in a really nice part of town for $1. That's not going to happen, right? Because that was genuinely still very valuable. Microsoft, Google, all the companies that survived the dot-com bubble in the late 90s, early 2000s survived because there was a real there, right? And I feel very confident that we are in the same boat, and again, it's all in our hands, and it's up to, God, honestly, and just making sure that we put our best foot forward. But I think that if we solve real problems and do something that is not just a me too type of product, that will stick around.
For listeners who want to learn more, what should they do?
So, feel free to connect with me, of course, on LinkedIn and on Twitter and Instagram, but go to criterionmd.com, criterionmd.com, preempt.com, and check out the website. See all the products that we have coming up in the pipeline. Sign up for the wait list. That's the first button at the top of you, and we'll be in touch. And if anyone wants early access and these things, of course, please feel free to reach out to me on LinkedIn or any other forum. Or I mean, I've gotten like 3 texts today about this, so call the number. Feel free to text me. It's okay.
Dr. Khatri, thank you very much for joining us today on APM Success.
Thank you so much for having me.
If you liked what you heard this week, head on over to apmsuccess.com, where you can find more content and free resources to help you build a successful career in anesthesia and pain management. If you wanted to leave a review in iTunes, I'd also really appreciate it. Thanks for using some of your valuable time to join me today on APM Success.